COVID numbers, they're looking pretty good. We've seen numbers hang out in the lower tier for a while now. This map that you're looking at shows that Guilford County is in the green. But we've been other colors before, and very recently we've been in the orange and the red. So COVID numbers look pretty good now. People head inside for colder weather, then the numbers creep back up, which is why we have Dr. Cynthia Snider from Cone Health here today. She's going to talk about how we can all keep ourselves healthy, make sure that those numbers stay low. So first and foremost, as we head indoors, right, because we've got those bursts of cold weather here and there, what should people do to keep the spread from going up?
I think the lessons that we've learned is that masking does work. And so we are heading into our respiratory season where we anticipate probably another surge of COVID coming our way. Probably not as great as what we've had in the past. And that is largely due to people either have immunity from having natural infection or more importantly, also getting vaccinated. And we also know flu. We know flu is going to be around. We've already had some signals in our communities, in neighboring states where they've had some flu outbreaks. And so we suspect it will be worse this year, as more so than the past 3 years.
Well, especially since most of us are not masking on a consistent basis, right? So Thanksgiving is next month. Maybe someone hasn't gotten their updated COVID booster yet. Should they do it now? Should they wait till it's closer?
You know, I think a perfect time to get it is now. Not only is there a choice, you know, some people can still stick with getting the mRNA vaccine, but there's also a new vaccine, the Novavax vaccine, which is more similar to shingles or the Tdap vaccine. And that's also another option for getting a booster. And especially maybe some folks haven't had their primary series. So that's also another option to get that Novavax vaccine series. And also definitely would still get the flu vaccine as well.
Okay, well, let's talk about that new booster that is out. Let's review what people need to know about it.
So, you know, I think a lot of folks initially have had some hesitation of getting the mRNA vaccine because that technology is new. However, the technology that was used for the Novavax has been around for many decades. And it's approved for those who are 18 years old and up. And sorry, take that back, 12 years and up. But if you, for those, you can get a booster after you finish that primary series. And for those who've had an mRNA series like Pfizer or Moderna, and they want to switch to the Novavax, you can be a candidate as long as you haven't had a previous booster for it.
Okay.
And it is formulated, you know, before these new variants. Like, you know, it has a high efficacy of 90%, but we still don't know what that number looks like in terms of Omicron variants.
Okay, so what is the timeline for that shot? Like, how long after your initial series do you need to wait for the Novavax?
So the Novavax is a 2-dose series for the primary series. And you can wait 6 months after that. But if you've had the other vaccine series, you can just wait 2 months.
Okay, so if you had the Pfizer, the Moderna, or even the Johnson & Johnson.
Correct. You can get another boost of the booster in 2 months.
Okay, and so then how do we register to get that specific booster versus some of the other ones?
You know, that you can go to some of your local pharmacies can have the various boosters available, but at conehealth.com, I think /vaccine, you can sign up and our pharmacies have access to all the boosters and you can just choose the one you want.
Choose the one you want. We like to be able to do that. All right, let's talk flu shots because like you said, flu, that is already going around. We're going to see it again as we head into the fall. Can someone get the flu shot at the same time as they get their booster?
Yes, it is very safe to get both of those vaccines together.
Okay, but if you do want them separate, let's say you're just like, I don't want to fool with that. I want to make sure that I'm good both ways. And you want to do them separate. Should you prioritize getting one versus the other first? Like, should you get the flu vaccine first or the COVID booster first or vice versa?
I would probably get I don't think there is that much difference, but I think given that they're starting to have flu cases in the community, it makes sense to get the flu vaccine.
Okay, gotcha. All right. So back to the family gatherings, which we're all going to do in about a month's time. Should family and friends test for COVID before they see each other?
Tanya, that is a great question. So the latest CDC guidance mentions people not to just test if you don't have any symptoms. However, that's different if you've had exposure. So if somebody's had exposure, a close contact with somebody that's tested positive or has symptoms for COVID, it makes sense for you to consider getting tested in that, day 5 window after the exposure. I would recommend that if for family gatherings that, try to be very conscientious of everybody else and try to avoid other huge gatherings or wear a mask, and then try to avoid any exposures to COVID before getting together for Thanksgiving.
Yes, an early Christmas present of COVID is not fun, not what you want to spread around on Thanksgiving. Okay, if we do test before we go, are home tests still accurate with this new variant?
From what we know, we do feel that they're still very useful.
Okay.
So they continue to work.
Okay, and what are some easy steps that everyone should take to avoid like co-infection from COVID and then flu?
Yeah, I think the same principles that we've been using over the last couple of years includes hand hygiene, coughing etiquette, try not to cough in your hand and then shake someone else's hand, and also and masking, obviously. So I think all those are very useful tools to preventing the spread of respiratory viruses. And especially if you're traveling, I feel that also wearing a mask on the plane is very useful and protective of the person. And also remembering that the best mask, the one that fits very well, that has a higher filtration. So if you can use a KN95 or a KF94, those are very effective.
Yeah, and nobody wants any of those for like the holidays. We don't want COVID, we don't want flu, we don't want norovirus, we don't want any of that stuff. All right, so you have your chance to ask your questions about this virus season. And so what we want to do is we want to show you this number. The number is 336-379-5775. You can get your question answered in real time. You got a question for the doctor, this is when you text it in. We'll be back in just a minute. All right, we are taking your questions about the latest COVID trends and flu and how you can get ahead of all of that. As a reminder, that number is right there on the bottom of your screen, and our Cone Health expert is Dr. Cynthia Snider answering your questions. All right, this first question is either booster more effective than the other?
So we know that there's probably some beneficial to obviously any of the boosters. The mRNA boosters of Pfizer and Moderna are considered bivalent, and they include some of the latest Omicron subvariants, including BA.4 and BA.5. So in theory, that might be more effective
than the Novavax.
Correct.
Okay. This next question is, since the timeline for kids is different, should parents pick the shorter series? Are they equally as good? So should they do the Novavax since it's a shorter time span, or does it really matter and they can do Moderna and Pfizer, doesn't matter?
So the children's series there are some differences between the various ones, and I would choose a shorter one because we're heading into a very significant respiratory virus season. As well as right now, there's a very high RSV burden in our community. So
yeah, it might have been different if it was like the start of summer or something like that, when you're going to be outside and it's not as cold and you're not inside as much. Okay, I understand that. This next question is, are the side effects different for the boosters? Like, is the Novavax, does it have different side effects than the other mRNAs?
I would imagine, since all the vaccines are really stimulating your immune system to produce antibodies and rev up your T cells, the side effect profiles are very much the same across the board.
Okay. This next question is, do you recommend mixing and matching or staying with one series?
That is a very good question. You know, it's been debated among both infectious disease docs and different immunologists. And the thought about changing your series up is that your immune system may create different antibodies. So there some theoretical benefits to it.
Okay, so it's kind of like really what you want to do, but you're laying it out there of that's what the thinking is.
Correct. And I'm a fan of, you know, that kind of makes sense, but I'm not sure if the data supports it yet. And then also, it's also about accessibility. Like if I'm ready to go get my booster and there's only one available, I'm sure I'm just going to get that.
So this next question is, should we be concerned about the myocarditis in men after this new booster? So that was talked about some earlier on with some of the mRNA ones. Are we concerned about that with the Novavax?
So they're seeing less of it in the Novavax arm, and again, it was really seen more in adolescents, and if somebody has had, for instance, that side effect with an mRNA vaccine or some significant like allergies, then the option would be to switch over to the Novavax vaccine.
Okay. And so this next question is, does the new shot, the Novavax, give you a bigger dose, or is it the same kind of dose as the Pfizer or Moderna?
So I'm not exactly sure about the dosing aspects of it, but again, the way that a vaccine is created, they're looking for an optimal like immune response. So that's how it gauges like the micrograms component of it. So it's a little bit challenging to say like it's apples to apples, but the key thing to note is that, you know, this is the Novavax vaccine. I think of it, I heard a great analogy. It's like, you know, you get exposed to kind of the eggshell without the egg, you know, and the mRNA is kind of thought about to be the egg, but your body recognizes it as being foreign, and so that you create those antibodies against the spike protein. It was developed to having like 90% effectiveness, which is great, and but we're not sure how well it responds with the latest changes with the subvariants.
All right, we have this last segment with Dr. Cynthia Snider from Cone Health. She's answering your questions about COVID spread, about flu, about all kinds of respiratory illnesses. In fact, this question is asking about RSV. So this person is asking, do adults need to be concerned about RSV, or is it just children?
So, you know, adults can also get an RSV respiratory infection, and commonly I think parents get it from their kids. So if you happen to live in a household that has RSV, it's important to mask because you're considered exposed, right? And then you could continue to go on with your activities, and it's usually supportive care. And but if your child has or if the adult has has difficulties with breathing or worsening cough, it makes sense to be seen by your medical provider.
So some folks out there may not even know what RSV is and how it differentiates from like a cold or a flu. So can we just quickly go over that?
Sure. You know, it's a childhood respiratory infection we see, and especially in young newborns, they are at risk of having respiratory distress, requiring to be hospitalized and potentially intubated. Right now, nationwide, we're seeing unprecedented waves of RSV in the community, and typically, you know, people can have like really sudden onset of fevers, chills, cough, and shortness of breath. It's probably not as severe in adults, but if you're immunocompromised, that tends to be a little bit more significant.
Okay. Someone is asking, can you review COVID isolation guidelines? So let's say you do have a coworker or a family member that has COVID. So then what happens?
So if you are exposed to COVID, I think I would say like the socially conscious thing to do is to wear a mask, and you don't necessarily have to stay home in quarantine. You can continue with your daily activities, but wearing a mask for the next 10 days. If you can wait to see if symptoms show up, to get tested, but alternatively, you can test after day 5 of isolation to see if you've converted over.
Okay, and so, you know, things have changed too of when you say you're exposed. So what would you consider exposed? Is it just someone in the building that has it, or is it someone that you're sitting close to for a while?
Yeah, so it's usually somebody that you're sitting next to for a period of even like 15 minutes if it's in a closed space. I would say folks who live in the same household have a higher risk of contracting COVID because it's still very contagious. And however, if you found out that you're one of your coworkers and you were in a lunchroom but greater than, you know, for further away and not necessarily spending that much time with each other, that's probably not a significant exposure.
Okay, and then really quickly, we've got about a minute long. Someone is asking about the time span after getting COVID. How long do you need to wait to get your booster?
You know, some people can, you're thought to be immune, you know, have a sufficient ramp up of your antibodies for anywhere from 2 to 3 months. But we've started to notice people getting reinfected at 3 months because of the different subvariants in the community. So it probably makes sense to get vaccinated at that 2-month mark or before.
The 2-month mark, right? So don't even give yourself a chance to possibly get it again. All right, thank you so much for your time and your expertise. We appreciate it. You can find a full recap from today's Q&A on WFMYnews2.com in just a few moments. Click in the Who Wants to Know section.